Okay, so we're going to go ahead and get started. So, welcome everybody. My name is Beth Salzberg, and I work here at Jewish Family and Children's Service in Waltham, and I run the Percolator Network. And I'm very happy to have you all here today. We're in a little bit of a different room than usual, but it's nice because we can see the snowy trees filled with sun in the windows all around us. So we have a dozen people in the room, and some others are going to filter in, I know, in the next few minutes. And on the phone today, we have about 35 people all over the country, and even another country. We have someone connecting with us from Portugal. So it's really exciting. If you are connecting with us by Zoom and/or conference call, just a couple of housekeeping items. One is that it's really important to choose either your computer audio or your phone, but to not use both, because if you use both, you're going to get an echo. And at some point, we're all going to hear that. And the other thing is that if you have a webcam and you'd like to enable it, then we would be able to see you in a little thumbnail. So that's up to you if you want to do that or not. But we certainly like to see friendly faces, so please feel free. And finally, if you're having any difficulty with the video or the audio, if you're having trouble hearing, send a message in the chat box and I'll be monitoring that during the meeting. So with that said, I'm going to dive right in here and get us started. Let's see. There we go. So today what we're going to do, some announcements to begin with, a few Percolator updates, and then we're going to hear from Brenda and Andrea representing the Burlington Council on Aging and the Friendly Day Café. And then we're going to take a little stretch break and go over the results of a Percolator survey. This one was about how cafes create a sense of belonging and community. Our next meeting is not Thursday, December 12th. I don't know where I got that. Our next meeting is March, and it will be on a Thursday. We alternate Wednesdays and Thursdays, and I will send you the correct date. It's definitely not December. It's definitely March. We are going to be joined by Mary Beth Riedner that day, who is a librarian, and she's the creator of Tales and Travel Memories, which I think some of you probably use in your cafe. I see some heads nodding around the room here. Mary Beth is part of the National Library Association Dementia Task Force, and she's been a real national leader in getting libraries energized and really taking a leadership role in memory cafes and dementia-friendly communities in general. So she's going to present to us from Chicago using the miracle of technology and share some ideas about using books and reading-based activities in memory cafes. So I think that'll be really nice for all of us as a network, because those are very accessible, low-cost options that a lot of people really enjoy. So I'm excited for that. And I am looking for a cafe that wants to do a presentation for our March meeting. So please let me know if you're interested. The meeting is being recorded. I hope it's being recorded. Let me just double check, actually. And I do apologize. I'm still new. Yeah, it is being recorded. I'm still new with Zoom, and this is not my forte. So I'll have my awkward moments, but I think you all can indulge me. The way we do our meetings, the final approximately 15 to 20 minutes is usually just discussion and networking. So if you need to leave early, you can feel free to do that at that time. And again, we meet quarterly, alternating Wednesdays and Thursdays, and that way people who have a cafe on either a Wednesday or a Thursday can at least join us some of the time. So just to let folks know who is here, so we have about a dozen towns represented in the room, and We also have quite a number of Massachusetts folks on the line from farther away. And we also have people from many other states, including very warm states that look really good to me right now, like Arizona and California, Hawaii. We're happy to have our New England neighbors as well in Connecticut, New Hampshire, and so forth. And as I mentioned, today it looks like the person from farthest is from Portugal, which is really exciting. And there will be opportunities that we can talk and you can speak up from wherever you are. So we definitely look forward to sharing and a real exchange. So with that, I want to make sure that the phone lines are open here. I'm going to unmute everybody and just ask if anyone has an announcement that they would like to make, and just if you wouldn't mind keeping it brief, that would be great. So the lines are open for anybody who wants to make an announcement. We'll start with people who are calling in, and then we'll go to folks in the room.
Beth, this is Emily Kearns from Massachusetts.
Hi, Emily. We hear you loud and clear.
Okay, great. I just wanted to share with everyone that we've started taking the Memory Cafe model and expanding or modifying it, and we are starting day-long retreats, or we're calling them a day apart, for care partners and their loved ones living with memory challenges. And we've done one. We've been asked to come back again at a retreat center. The next one is May 26th here in North Andover, Massachusetts at Rolling Ridge. So if anyone is interested in this emerging model, please contact me. It's really exciting. So it's the Memory Cafe model using some of the evidence-supported programs like Music and Memory and Time Slips in a day-long community fun and games and food program. Thank you.
That's great. And if anyone needs Emily's contact information, feel free to drop me an email and I'll get that for you. By the way, it looks like, so I have unmuted everyone, but I think there are some of you who have muted yourself. So if you want to talk, you may have to actually press the unmute button on your phone or your computer. Anybody else on the line who would like to make an announcement?
Hi, Beth. This is Kim.
Hi, Kim.
So North Carolina had a statewide meeting to see if we'd like to form a network in October, and early this month, we decided that yes, we're going to go ahead and create a network. So thank you all for the inspiration, and we're learning a lot from you guys.
That's great, Kim. It's really exciting. I've heard from people in several regions around the country and also other parts of Massachusetts that are now forming Memory Cafe networks. So it's really nice to see these models for collaborating and coordinating and really supporting each other. So definitely keep us posted. Would anyone else like to make an announcement? Okay, how about folks in the room? Okay, so I'm going to jog over here, Keith, with the microphone.
Memory Cafe started a lending line at our cafe last week. We have a set of books that are tailored for those with memory challenges. So take a book, like the model that we had, and see how the returns go at the end of this month when we have our cafe. We're excited about that.
All right, that's great. So we will go ahead. So I'm going to mute the phone lines just to keep any background noise down. But let's see. I have to remember to unmute myself. Yeah, okay. So again, if you want to communicate with me at any point, please send a chat message. And definitely if you're having trouble hearing, you can do that as well. And it looks like there is a message here. Okay, Lori, So Lori, if you're having trouble with your microphone, I'm happy to, oh, in fact, you did go ahead and type in information. So Lori Mance from Rhode Island is, so she was here in person a couple quarters ago and was just starting out the first cafe in Rhode Island. And now they are up to 9 cafes and growing. So let's hear it for Rhode Island. That's wonderful. And Amy Walsh in Boston says, after meeting with the Disabilities Commission here in Boston, they asked to make sure all our memory cafes are accessible. So that is a very good reminder that we should always be mindful of physical access as well. And, you know, I think cafes tend to choose a meeting place that's quite physically accessible, but it's a very important consideration. And as a network, we've also worked a lot on access for people with intellectual and developmental disabilities who have also developed dementia, which is a growing population. So thanks for that reminder, Amy. So with that, what I would like to do is go over a couple of other Percolator announcements. So here in Massachusetts, we're up to 116 cafes, and that includes 3 cafes in Spanish, 2 in Portuguese, and 1 in Chinese. And we have the statewide directory there. There's a national directory that many of you are familiar with, run by a guy named Dave, who is really devoted to making cafes accessible to people around the country, and his URL is memorycafedirectory.com. So he and I are in touch every week whenever I get new information about a Massachusetts cafe, or he gets information about a Massachusetts cafe, we share it so that our Massachusetts directories are synced. So thank you to Dave, and check that out if you haven't seen it, because sometimes you might be approached to find a cafe in another state for a family member. So he is keeping that resource up to date. So also to mention, we have a webpage, jfcsboston.org/percolator, where I'm trying to keep all of our main resources, the toolkits, and videos and so forth. And there is a Percolator Google group up and running now. Several of you have used it. So that's a way you can talk to each other about ideas or questions. If you did not get an invitation to that, just let me know. Some people, their servers reject it, or they didn't see the message when it came through and then it expires. So just let me know. Likewise, if you're not getting the Percolator emails, let me know, because some organizational servers reject them. If you have topics for Percolator surveys or meeting discussions at any point, just give me a holler. I would love to hear your ideas. So with that, I'm going to invite Brenda and Andrea up to the microphone here, and they will, whoops, let me go back. They will tell us about their cafe. So you can just advance it right here.
Perfect.
Okay.
Great, thanks. Hi, I'm Andrea Cross. I'm Brenda Pappas, and we're with the Burlington Council on Aging. We're both outreach workers there, and we also have another part-time outreach worker who does a memory cafe with us. Can you hear me okay? Okay. So we want to tell you a little bit about Burlington, just so you have a sense of the town. We're a town of about 26,000, with our aging population over 65 at almost 5,000. We took this information from the Tufts Health Plan Foundation, and they did an estimate that about 13.5% of our population has dementia. So that just gives you a sense of it. We also have our over 65 population, about 90% are white, and then about almost 9% are Southeast Asian.
So at the Burlington Council on Aging, it's pretty busy. It's a pretty active senior center. As Andrea said, there's 2 of us that are full-time social workers, outreach, 1 part-time. We have many, many programs like most senior centers do. We're very lucky to have Leahy Clinic in Burlington. Leahy Clinic and Medical Center is obviously our local hospital. And it's really helped out the Council on Aging in a lot of different ways over the past several years. They've given us a van. They they sponsor exercise classes every week for our seniors. Seniors don't have to pay for the exercise classes because Leahy sponsors those. They started sponsoring a farmer's market. I think it's 3 years ago now. I think we might have just had the third or fourth year for that. So once a week, seniors can come and get a free bag of vegetables, and that's through a local farm network. And so Leahy has organized all that, and they do other events as well. So they're also our sponsor for our Memory Cafe. Oh, thanks.
So just a little bit about how our cafe started. In 2018, our director at the Council on Aging met with our community relations person at Leahy, who they work together a lot, and suggested starting a cafe. The reason Leahy was interested was apparently every 3 years, local hospitals have to do something called a community health assessment. And in it, in 2016, Leahy had decided that elder health was identified as one of their highest priorities. They identified stress and burnout among caregivers as one of the greatest threats to seniors' well-being. And they had a goal of enhancing caregiver support and reducing stress. So Memory Cafe kind of fit perfectly with what they were aligning. And they came through with completely funding the Memory Cafe. So we feel very lucky, and we know sometimes the funding piece is sort of the hardest part, but Leahy's been a great partner with us in that.
So just a little bit more about that. Beth thought, and I thought that it would be helpful maybe to some other people to find out more again about the survey, how that led to Leahy identifying these areas that they wanted to address, and also maybe potentially it could be a source of funding for other people. The community relations manager at Leahy, Michelle Snyder, gave me this information. She said every 3 years, hospitals are required by the IRS and by the Massachusetts Attorney General's office to conduct this community health needs assessment to assess and prioritize health needs in the community. So anyone, I would imagine, in any community, there's always going to be some sort of a hospital that's affiliated with that community. And it's possible that that might be a way to look toward funding through your local hospital. So I just wanted to mention that. Are we on this? No, we're on. Okay, so the beginnings, back to how we started our cafe. Back in May of 2018, our director and the community relations person from Leahy, Michelle Snyder, started talking about doing the Memory Cafe. To be totally honest, I wasn't really that happy about it when they mentioned it, because I thought, are you kidding me? We're going to do something else, because we do a lot. You know, we're full-time outreach workers. I have a caregiver support group. We write for the newsletter. We do home visits. We just do everything. I'm a Shine counselor also. And my initial thought was, we can't do this. We can't do one more thing. But I'm really glad that we did it, that we ended up doing it. So we started out with our first step, once we decided that we were going to do it, was to start visiting area cafes. So we visited many in the area just to get a sense of what they were like. And then we started to ask right away, like, about their guest artists, because we wanted to know that we had a good network to draw from. Of course, we read the Memory Cafe toolkit. We used that. That was really helpful. And then we also were talking with Beth early on about how to publicize the cafe to the community. Really helpful is we had the Dementia Friends kickoff in September. And what we really tried to get a lot of the local people that interact with seniors all the time to come to this. And so we invited the library, the housing partners, not just the subsidized housing, but we have a lot of apartment buildings in Burlington. So we reached out to a lot of the management in the different apartment buildings. A few of them came, not all. We had fire department, no, I'm not sure if fire department came, but police department, we have a senior liaison that came, library, and then they ended up getting more involved too, which was great. just, we invited a lot of people. Not everyone came, but we had a very good turnout. Many of the people were just our Burlington seniors that did come. So that was in September, and then we planned our first cafe for the following month in October.
Okay. So before we started the cafe, we wanted to make sure the community knew about it. So some of that was sort of the Dementia Friends kickoff to explain what a memory cafe was. But then we also did press releases to local newspapers. It's always in our senior center newsletter that goes out to our seniors. We went with our ASAP, which is Minuteman Senior Services, and let them know about it, especially case managers we worked with, adult day health programs that are in the area, and the local housing authority. Our director also has a program on BCAT, which is our local cable channel, and so she announced it on there. And I think we also did some just small announcements. We also linked it to the public service announcement that's on the Percolator. That's just about memory cafes. Again, just as a wider community effort to make sure people understood what memory cafes were at that point.
So we have our cafe. Obviously, it's the same day every month, third Tuesday. We picked it based on other cafes in the area. So we didn't coincide with anybody else's. Our format is it starts at 11, goes till 1. We have a guest artist in the first hour, and then we have lunch after that. We get lunch from La Cascia Bakery. It's very popular. Very good sandwiches, mini pastries or cookies. And once I forgot to order it, and we had pizza instead, and I think there was like a little bit of a backlash about that. But the lunch is definitely very popular. So we have to limit it. We decided to limit it to 30 people because I personally think that when anyone comes to present, sometimes the circle is enormous. It is enormous with 30 people, and then it just seems more manageable. So we do limit it. We have a first come, first serve sign up at the beginning of the month. And we have a wait list after that. And a lot of times people on the wait list do get to come because we really encourage, and people have learned, we have a lot of regulars that come. Please call us if you're not going to be able to make it. It's perfectly fine if you can't make it that morning. Everyone understands if you're having a bad morning. And then we can call someone from the wait list, so that's great. There's 3 of us staff that help, which we got it down, like everything down now really, easily. We have 4 volunteers who are fantastic. 3 of them, I personally picked them out myself because, I wanted to have people that had the right temperament and the right personality. And we're really lucky. One of them is a senior in Burlington. She's retired, but she used to be an activities person at a assisted living. One of them is a gentleman who lost his wife to Alzheimer's. He took care of her for many years, like 10 years at home. And the other volunteer is just a vivacious, awesome person who also had people with dementia in her family. So they all had experience already with people with memory disorders. And then we have the library person, Cara Enos, who got on board with us, and she acts as a volunteer. She's done a lot of just the setup, like everybody else. We'll say more about the library. We set it up with a resource table with all the different calendars and other information that would be interesting to caregivers. And as I said, the librarian, Cara Enos, she was one of our first people, and she's been coming every time. And about maybe 6 months ago, she came up with the idea of bringing books to the cafe, library books that can be checked out right at the cafe, feeling like, the caregivers may feel like they don't really have time to go to the library anymore. So it's really convenient for them. So she sets up a table, she picks books that she thinks would be appealing. And so now when the people come to the cafe, they can just walk over to the table and take a book and then bring it back to another cafe. So that's really been working out nicely.
So we also had a volunteer who works in the senior center who also has family who has dementia, and she started purchasing puzzles for us that are specifically designed for people with dementia. So that hasn't quite taken off yet. We just started it last month and people didn't quite know what it was about. So we'll also offer that along with the sort of library takeout. And that's just from the Council on Aging. We don't know, like you, if how many are actually going to come back to us. But it was a nice, generous donation from someone. So we're also trying that as well to see if that's helpful to caregivers. Oops. Oh, no, here.
Little box came from.
I know, I don't know if I touched something.
Let me get rid of it. There.
Oh,
Okay.
perfect. Okay.
So we already, I think we already did. So, yeah,
So guest artists, we sort of went out when we initially went out to cafes, and I just harassed people about who they liked for guest artists. I thought it was obviously a critical component and like what worked and what didn't work. And I found some cafes really liked the entertainment aspect. We really wanted to be, engaging and interactive with people. We thought that was sort of, what kind of kept them coming. And so I started with Beth, and then as she gave me great people, I harassed those people who came and asked them who they would recommend. So that's been like the greatest source for us of referrals and how we started out. And of course, the Percolator also has the list, so I'm always sort of checking off on that list as well. Our favorites by far have been movement therapists. They can handle the large group, even though I usually try to warn them it's 30 people, it's a really large group. We've loved drumming. We've had a lot of pictures up of barn babies. People could come and cuddle. We had little goats running around, a pig. One of the goats jumped on the table. It was quite fun with the barn babies. It's one of the more expensive ones, but it was certainly, we all loved it, especially staff. I loved it. Our storyteller, Art Matters. We just found artists who had experience with dementia and were, used to running a group. We had one artist who recently didn't show. And I was trying to run the group, and I realized how difficult that is, and that is just a skill I have not perfected yet, and that's just so important in picking artists. We've had some who are really fast. It was an exercise person, and she's used to just going, and we felt like it was fast for us. It was fast paced for them. Some were really loud, and so that's how we sort of try to weed through people, is find out what their experience was and if they're used to running groups. That's been very helpful.
So we've had a pretty consistent group of people coming to the cafe. We do have mostly couples, married couples. Most are probably, like a lot of cafes, early to middle stage in their disease. We have one or two professional caregivers who come with the person that they take care of, and one or two adult children with their parent. We're really happy that there was not a group home, but a day program of, like you had mentioned, Beth, intellectually disabled folks who are younger but have dementia. And they found us, and so they've come many times with a staff person, 2 or 3 people. So that's great. We definitely want to be welcoming to everybody. And I think that one of the best things that's happened with this consistent core group is that the couples that have started coming to the cafe, even though it can be a little bit cliquey, we try to encourage them, not forget it's for everybody, but they're really connecting, which is great. Is maybe 6 to 10 to 12 couples where one of them has dementia. What's great is that they're coming to more events at the senior center together now. So where they wouldn't necessarily have come to another event, now they are. So they're definitely getting out more. So that's one of the positives. And also, some of the people that are coming to the cafe are now following up with Andrea and I and trying to get more information about other concerns that they have and other resources that they're in need of. So that's great. Oh, the calendar. We do have Yeah, I think I mentioned over there, we started a calendar, we try to keep up with it, of the area, and every time we say, don't just come to our cafe, go to other cafes, go to Woburn, or go to Woburn has a new one, go to Winchester, go to Arlington. We also, I'm not sure, I lost my place here.
Yeah, sorry,
We're meeting, so why don't you go to the next one now?
So just sort of, as we've been putting this together, we've been talking obviously a lot about the Memory Cafe. Usually we're, planning it and doing it, but sort of being more thoughtful about it. We're trying to figure out sort of how to be more inclusive. We were talking, we have this large Southeast Asian population that's very active at our senior center, but they're not coming to our Memory Cafe. And we know there's obviously memory loss issues going on there. And so we run an Indian lunch. And so we were just even talking today, like maybe one of us should go up and talk about the Memory Cafe and invite them to that so they're aware of that. But just sort of in a general sense, how to be more inclusive to our community. And then one of our guest artists I was talking to, and I'm always curious about sort of how effective is this for folks, for caregivers when they go home. Is the person more engaged? Is they tired? Does it change their day? Does it help the caregiver? So I'm interested in sort of figuring out sort of how do you do research on that? And one of the guest artists was sort of interested in trying to help me figure that out. I didn't know sort of in the community, are people doing that kind of research? The only things I sort of found was sort of a study done in England and somewhere else, I think Australia or New Zealand, I can't remember which. So just sort of future thoughts as to sort of our Memory Cafe and how effective is it? And is there anybody else out there doing any research on it? So we can answer any questions. If you have any questions about what we do, more than welcome to answer that.
And the links on this bottom of this page, if you haven't ever looked at the first one, the Healthy Aging Collaborative, you can look at each and every town. These were done through Tufts Health Plan, but it's all Medicare. It's generated from Medicare, so there's a lot of very good information on that survey. Questions?
Thank you so much. That is wonderful. Don't go away. I think you raised several things that we could delve into in more detail. And I just want to first check the chat box here because I see that a few people have commented. And thank you for your patience. So let me see. Oh, good. The audio and video are working. That's good. Very happy about that. Let's see. So on the research front, so Lori in Rhode Island is saying she's wanted to do research but hasn't started. She'd love to involve their OT students. So that is a really big, important area for us as Memory Cafe people because, as you mentioned, there's just a handful of studies that generally are just of one cafe. Most of them were done in other countries, which doesn't mean they're not applicable, but sometimes it's a little hard to translate some of the findings. For example, in Europe, a lot of times there's a public health nurse at a Memory Cafe, and they do more education and sometimes even the beginning of a diagnosis at a cafe, which is very different from our model here in the US. So I feel like the time is really right for a large-scale, multi-site, rigorous evaluation of memory cafes to really try to build the evidence base and get at some of the outcomes, which is what you're talking about. We know people really have a good time while they're there, but does it actually affect social isolation and how much? Does it have a lasting impact on the mood and the quality of the relationship between care partners, things like that? We all have many, many anecdotes, but we don't really know in a more kind of rigorous way what the answer to those questions is. So I keep talking to funders, I keep talking to researchers, try to make a match, and I think there are other people around the country doing the same thing. And if you're out there, university-based research person who has a grant or an idea of a grant, I feel like this is a great project for somebody to take on. It'll really have a big impact. And we have the sites, we have the programs, so it's just ready to go. Now, that said, I think most, if not all, cafes do an evaluation of some sort. And we spent a Percolator meeting focusing on that a year or two ago, and I'm happy to share those slides if anybody would like them. So for an individual cafe, there are lots of ways to get feedback from your guests and use that feedback to help you improve the program. And you can ask questions about, does it affect the rest of your day? Does it affect your week? Have you met people at the cafe that you see outside the cafe? But I am sort of distinguishing between the kind of level of information that we're really able to get as programs, as opposed to what researchers who that's what they do, is they understand the evaluation tools and how to get enough participants that it's statistically significant. So that's kind of a different piece that hasn't really happened yet on a large scale. So anybody have questions for Brenda and Andrea, either folks in the room or on the line? I'm going to go ahead and unmute the phones. Unmute all. Okay, so feel free to speak up, anybody. Okay, I'm coming. So one thing I did hear for the phone.
So I think it's pretty interesting. So our Cambridge one is a collaboration between a local youth center on aging. And I think the idea of us involving, as we're getting ready to do our grant sponsor next month, it's somebody that I've been involved with now for 2 days. The one in East Cambridge and the one in Burlington. And I think pulling in that information from your example, Leahy, from our 2 local hospitals with our sponsor would be a great idea to explain a bit more. And I also like the idea, and I'm appreciative that you mentioned it, because we have noticed lately that we are kind of at capacity and almost outgrown our room. And so maybe the idea of talking about whether we should have a wait list or a cap, so that it doesn't have to be or we're rearranging the room for people who come in.
How many people do you have? How many people do you have? Oh. Yeah. So on the slide is Leahy's link to their latest survey. So if you want to look at it, then you can also try to find it on, I don't think each hospital has a particular place they have it, so you might have to search.
So there's a question here. I couldn't quite hear who you invited to the kickoff for the cafe. So I wanted to talk about that a little bit more if I could, because Brenda and Andrea mentioned that we did what's called a Dementia Friends information session. And I know a lot of the folks in the room and on the line are familiar with Dementia Friends, but not everyone is. So Dementia Friends is a global public awareness program, and there are chapters now in about 23 states. And I run the Dementia Friends program for Massachusetts, so I know it well. And so the standard information session lasts an hour. It's interactive, and it teaches some basic information about what it means to live with dementia, how it affects people, and then how everyone in a community can, through awareness and through some simple steps, make a difference, make our communities safer and more inclusive. So the nice thing about it is that it's really a volunteer activity to come to one of those sessions. At the end of the session, the person is counted as a dementia friend. They get a nice little pin, they get to be in a photo, and they can feel good about what they've learned. So it's a nice activity to make part of a Memory Cafe kickoff event. So I think what was interesting for me about coming to Burlington and doing that session is that then we tagged on about a half hour about what is a Memory Cafe. And I showed slides to show people what it looks like. Now we have that 60-second PSA video, so that's something you can always show if you want to illustrate what is a memory cafe. And then at the end of that, I asked for everybody in the room to really be the ambassadors for Burlington's new cafe. And if they know someone who might want to come, to please invite them. And we did talk about how people become isolated due to dementia, and a lot of people don't know about memory cafes. They've never heard of the concept. So for those two reasons, it's really helpful if they hear from someone they know, oh, I heard about this new program that the Burlington Council on Aging is having. It looks great. You ought to really come check it out. Maybe we'll go together, things like that. So I do want to let you know the Dementia Friends information session is available. Here in Massachusetts, there's about 315 trained volunteers all around the state. Keith is one of them. Any other Dementia Friends champions in the room? So there are a lot of people all over Massachusetts who are available to do these sessions. They're free. There are even about 25 high school students right now that are trained to do them. Several other states that are represented on today's call have Dementia Friends programs. So just right off the top of my head, Connecticut, Hawaii, the southern half of California, many, many other states. You can go to dementiafriendsusa.org and see if your state is listed and get the contact information there. There are other resources for that kind of introduction to dementia training. The Alzheimer's Association provides a lot of similar trainings, and there are other trainers, other resources available in different parts of Massachusetts and different parts of the country. So you could consider having an educational event like that and including what is a memory cafe and a kind of introduction to your cafe. And you could do that even if your cafe's been running for 2 years. If you're trying to find a way to broaden the attendance, you could plan an event like that at any time. And that way you're bringing in people who might not necessarily plan to go themselves, but they may well know people who they could make a personal invitation to go. Anything you want to add to that?
Hey, Beth, may I add something from Connecticut?
Please, go right ahead.
Thanks. We are at LiveWell the Dementia Friends champions for Connecticut, and we're very lucky to deliver the Dementia Friends information sessions along with someone who's living with dementia. And often what they do is they tell some stories about the warning signs and give firsthand accounts. And what's interesting here is the possibility of kind of cross-pollinating. People who attend our cafes might be interested in advocating in that way. So when you bring those two things together, it gives people an opportunity to see how they might help advocate to advance the Dementia Friends movement.
That's great. Thank you, Katie. Appreciate that idea, that concept. Hang on, Tracy. Let me bring the microphone. Because I know the folks. Not everybody on the line has access to Dementia Friends, but a lot of people do. And for those who don't, you probably have access to other trainers in your area. So it's something to think about. I think for me, the key issue here is that, sometimes when we think about memory cafe outreach, we think about reaching the people who are living with dementia. But this is a way of reaching out to kind of a broader section of the community with dementia education, and then helping them know about the cafe. And more than likely, they know people in their lives who are living with dementia. So sometimes helping those people gain the knowledge they need and then have them be your ambassadors is a pretty effective way to go. Because what we know we're working with here is a situation where lots of people don't know about memory cafes, and lots of people don't know what dementia is, or they don't know about it in a real clear way, or they don't know how to talk about it. They don't know how to start the conversation. So an approach like that is kind of helping them make that link for you. So there's a question here. Did you want to say something about that?
No, I didn't. I
I didn't know, do you want to talk about the kickoff event? Somebody asked like who came, who we invited. They didn't quite hear that.
So we invited everyone we could think of that we interact with on a regular basis, like the housing partners. We get a lot of calls from apartment building, managers with problems, and so the fire department, the police liaison, we asked library. I also reached out to some nurse practitioners that we deal with a lot through a couple of different doctors' offices. We reached out to the VNA, the ASAP, Minuteman. I'm not sure, I think we had someone from Minuteman there too. So just everyone, but then, I was thinking later we should have included the post office and, other people too, not just those, official like professionals that we work with, but everyone that works with seniors, I would say, and post office works with seniors a lot, the mailmen. So just to think about everyone in your community that would be interested. That's what I would recommend.
Great. So there's a question here from Northern Arizona. We're just getting started. What liability insurance do you have for the cafe? Any special insurance for having animals?
We only had the animals one time. I'd love to have them every time. They were really expensive. It's called Barn Babies, but it was great. No, we didn't have any special insurance. I think our senior center, because it's a town, Council on Aging is part of our town. So I don't think we needed any special insurance that I'm aware of.
Is there anybody here who is doing a memory cafe outside of an organization like a senior center? I'm looking around and I think, no, but the synagogue probably already has liability insurance. So I think if you're doing it and you're part of an organization that already
No, that was before you were here.
that already has people
You at ESP.
coming and going and doing various things, then I think you probably wouldn't need anything extra. I think one concern a lot of people have about memory cafes when they're thinking about starting one is that they're afraid there are going to be a lot of behavior issues or, emergency situations. And that just hasn't been the experience of people who run memory cafes. So generally speaking, if you're in a setting that already serves the public, whether it be a library or a restaurant or a house of worship or a senior center, you're probably already insured the way that you would need to be for this program. But that said, that's going to be a very individual question. I am not a lawyer. I am not qualified to give legal advice. So you should definitely look into that for your own particular setting. I think there may have been another question that come in. Okay. So Lori in Rhode Island says they have people sign a release of liability. So that's one way to go, is if your setting requires something like that, you might have a release form so that people are signing that they're not going to hold you responsible if some sort of issue comes up. Any other questions for Andrea or Brenda? I'm going to enable or unmute participants again. We were getting a little feedback. Anybody else who is on the phone or on Zoom who might have another question or comment? All right, well, let's give a hand to Brenda and Andrea. Thank you so much for sharing your experience with us. So we're going to have a little bit of a pause before we get into our survey results, and we actually have a little treat here today because Maria Skinner is here, who is a very active guest artist in the Memory Cafe Network here in Greater Boston, and she does something called Ageless Grace, and she very kindly offered to do a few minutes of that with us to sort of get the blood moving before we delve into our data. Oh, she's been to several of the cafes represented here. The one tricky thing, Maria, I'm afraid to move our camera. So it's seeing the person here.
Yeah, if they can hear me, they can do it along.
Yeah, so I think you may not, if you're connecting with us remotely, you may not be able to see Maria. Actually, Maria, just jump in front of just say hi.
Hi, I'm gonna play.
But you are going to be able to hear her. And we're just going to do this for a few minutes to get the blood moving, and then we're going to go to our second topic. So it's 6 minutes. So hopefully you folks at home or in your office will push your chair back from your desk and take advantage of this chance to get the blood moving a little bit.
Love it. I don't know what they say after. Okay, so we're going to start with something called gentle geometry. And so move yourself away from your table. The primary benefit here is neuroplasticity. It activates more neurons. You can take the right leg and make a triangle. I know I didn't worry you. You're not going to be able to get this right.
Beth, you know what you're gonna do.
Yeah, she's got to do it. That's her. You're not on camera though. I know. All right, now we're going to take the right arm and make a vertical line. No. How's it going? All right, we have to switch sides. Let's take the other. Let's just start with the vertical line because that's really easy, right? All right, now let's make a circle with the right. Okay, now check if your vertical line is still straight. All right, now what are we doing with the foot? Was it a triangle? Okay, it activates your funny bone. You're allowed to laugh. Oh, good. All right, good. Let's let that one go. So the next, I'm going to speed up the music a little bit. All right. We're going to play sports. We're going to play basketball. Ready? So bounce the ball around, and then you're going to toss it at somebody. Bounce it around. Yeah. Somebody else. Okay, now you're going to like take it under your leg, and then under the other leg, and then you're going to swirl it around like the Harlem Globetrotters, and then you're going to shoot the basket just like that. Ready? All right. Take it under. Under. Twirl it. The basket. All right, let's play hockey. Ready? Anybody know how to hold a hockey stick? Anybody can go like that? Okay, watch. This is the next person. There? All right, and how do we, see, all I know about hockey is everybody's always fighting. Right, so let's let Chuck. Oh, that's good. Good. Okay, let's let that one go. The last one we're going to do is called using joints and all about activating the joints. So let's pretend we're jellyfish. So everybody sit back in the chair, and maybe your legs are jellyfish tentacles too. And then we're going to be a jellyfish stretching. It's going to go. All right. That's good. That's what we're going to do. That
was really fun. So I hope that people who are joining us remotely were jellyfish. Were you guys jellyfish also? I hope so. And I hope you could hear okay. Okay. Thanks a lot, Maria. That was really fun. it's, now we know how people feel who come to our memory cafes, and they're always getting to do something different that they've never done before. So it's good for us to have the chance as well. Very invigorating. So now we are going to talk about the results of the most recent Percolator survey, which had to do with creating a sense of community and belonging in our memory cafe. And we know that that's really kind of the most important piece of memory cafes, is they create that sense of belonging. I'm just seeing some feedback that it's a little bit hard to hear when anyone is away from the podium. So thank you for that feedback. It sounds like the portable microphone may not be as effective. So I think the rest of the time we'll be at the podium here. Keep that feedback coming, please. If you have trouble hearing, let me know. So, so who responded to this survey? So 57 people responded. And you see how much fun everybody who responded to the survey had, all these dancing people. So if you didn't respond this time, you'll have a great time responding next time. But we really do appreciate it. So thank you to everyone who took the time to do that. 60% of the respondents are in Massachusetts, 40% are from lots of other places. And the great majority of the respondents have been running their cafe for over a year. So they have a good amount of experience. I'm just gonna mute the lines so we don't get any background noise, but please, if you have a comment, just use the chat box and we'll open those lines. Okay. So a couple other kind of demographic notes. 77% of the respondents have a cafe that meets once a month. A smaller number meet either weekly or twice a month or less than once a month. So most are doing a monthly gathering. And almost half meet in a senior center. 16% meet in a library. It's been really interesting to see how libraries are really emerging as one of the primary settings for memory cafes. It's great. 10% meet in a house of worship. And the other quarter meet in all kinds of places: adult day program, museum, restaurant, arts center, nature center, municipal or corporate building, aging services provider, animal welfare organization. So that's interesting. There's a cafe that meets at a kind of an animal shelter, and their activity involves interacting with the animals. Really, really great. So that's who responded. So what did folks say was the biggest challenge to this goal of creating a sense of community and belonging? Well, no surprise, it's the disease, it's dementia, and specifically attendance, consistency of attendance, and getting people to come in the door the first time. So I thought this quote really said it. Our issue is not creating community once people attend, it's getting people to attend. Some people living with dementia become highly resistant to leaving the house. And, I'll just comment that it can just be very hard to leave the house. It can be especially hard if people don't have a consistent care partner, or if they don't have the resources to hire someone to help. It can just be really hard to get there. And so this person continues, we have to get the word out to people in a small window of time while they're mobile. So it's tricky because a lot of people don't get diagnosed until later in the process, or they may not get diagnosed at all. And then as the disease advances, it may become harder and harder for them to try something new. So there's kind of this window of time where we're often trying to catch them, where they're feeling like they need something and they're also able to access it. And then once people attend, we know there's ongoing turnover in attendance due to disease progression. So unfortunately, these are things we can't change. These are the challenges of dementia. So what can we do? And the respondents to the survey talked about what they do in a number of areas. And the survey sort of got at what are the most important ingredients. And the way it came out was, number one, staff and volunteers, so people. And then atmosphere, activities, marketing and communications, staying in touch between cafe meetings, and rituals. And I just want to say this is not a scientific survey. None of the Percolator surveys are. We do our best. I work with someone in our Department of Evaluation and Learning who's very good at constructing a survey. But you know, I sort of created these buckets and then people responded. So take it for what it is. I hope it's useful, but I don't claim this to be the last word. So the key words that just came up again and again in people's comments were welcoming and hospitality, which I think is really interesting. That's probably not surprising to anybody here, but you know, what didn't come up was education or referrals. You know, what really came up was welcoming and hospitality. That's what Memory Cafes, sort of their magic seems to be. So we're going to dig into each of these ingredients a bit. So number one, staff and volunteers. And that happens to be a photo of a group of my volunteers from Brandeis University up there in the corner. So these were comments that respondents to the survey made. Consistent volunteers, and this person used the phrase familiar faces and watchful eyes. And I thought that was helpful because volunteers, they provide those friendly faces. They can round out the cafe population with different ages, with different ethnicities, languages, etc. They can help you create the range of people that represents your community who you want guests to see when they walk in the door. And if they come time after time, they become familiar and trusted people to your guests. And they also provide more eyes and hands on deck. So if somebody's having a little difficulty, or if someone just is sitting alone and has no one to talk to, you've got those extra people to go over and help out. So another comment that came up several times in the survey was that the volunteers need to be trained in a way that emphasizes communication skills and dementia-friendly philosophy. So it wasn't so much that they need a lot of clinical knowledge about dementia, it was more attitudinal. It was more that they need to see their goal as helping people live well with dementia and to know some things about communicating. And by the way, the Dementia Friends information session and similar trainings offered by the Alzheimer's Association and others can also be a great resource for your volunteers to give them some background information about dementia and how you really communicate with people living with dementia. Now, ages and backgrounds of volunteers vary. So cafes have high school students and college students come in, they have working adults, they have older retired adults, they have professionals, they have non-professionals. So that did not seem to matter so much as the attitudes and the philosophy of the people coming in. And then another set of comments had to do with how the volunteers and staff interact with guests so that they greet guests by name. And so name tags are really important. And they introduce guests to one another. And one respondent said, we always seat new people with regulars. So they're sort of facilitating, helping people at the cafe to really connect and get to know each other. And this is why I always say to people who are thinking about volunteering at a cafe that it's like hosting a party, because that's really what it is. You know, if you have a party, you want to make sure that everybody gets introduced. You want to say, oh, you know, there's a person over here I think you'd love to meet. Let me introduce you. So it's that kind of thing that becomes so hard for people living with dementia, but that they really need just like everybody else so that they can feel comfortable and at home and valued. I'm just going to check. I think there are a couple chats here. So Lori's commenting that this is publishable research. I feel like these surveys are going to be really useful for a real researcher to start with, but we need to take it to the next step. So number two, the second ingredient that popped up was the atmosphere. So some of the comments were A lot of cafes have themes. So seasonal themes, holiday themes, activity-based themes. One person has a beach party every year. So that creates a little bit of a context that guests seem to really respond to. Second, food. Food is good. Seasonal food, again, feeds into that theme and something special at a particular time of year. Tasty food. A lot of people are able to get food donated by local entities, and I want to go eat at the Burlington Café, which sounds like a delicious thing that you have the lunch from the wonderful cafe there. So that makes it really special and feel like it's a particular place, a moment in time, not sort of a generic kind of industrial experience. Attractively displayed food, and there's a photo in the corner of Miata there at the cafe in Clinton where she has a kind of Thanksgiving food display set up. And one person wrote in and said, sharing a meal is very important to creating a sense of community, which I think was a really nice thought to include. So making the room look like a cafe, and people are doing that in all kinds of ways with different touches, but the underlying theme is that it shouldn't look like a clinical kind of a program. It should look fun and homey. Making the room look special is really nice. So several people mentioned that they use tablecloths. One person mentioned centerpieces, LED candles, things like that, that just make it feel a little bit special. Soft music to set a mood. So music is challenging because background music can be distracting. This is something that I changed for my cafe after a couple of years. I had this cafe playlist with a lot of songs from different eras and different cultures, and a lot of it was very upbeat. But I noticed that it was hard for people to talk while that was going on. So I switched to one of those Windham Hill CDs for the first half of the cafe as people were coming in and getting settled and talking. So it's instrumental, it's very subdued, it's a positive mood, but it's something that doesn't actually catch people's attention. And then at the end of the cafe, in the last 20 minutes or so after our facilitated activity, that's when I put on my other playlist, which is, you know, an injection of something to talk about, something to notice and pay attention to as people are kind of winding down. So I have found that the instrumental option can work better. Activities. So this came out as number 3. And there were 3 concepts that just kept jumping out in the responses. Respectful, and being really careful to not infantilize people. Interactive, so not a performance, not something you watch, but something you do. And failure-free, which means there can't be too much emphasis on the final product, but more on the process. Music and dancing, people love music. That definitely was mentioned many times, and movement. The cafe is equally important for the care partners, so the activity must engage them as well. Get regular feedback from guests about what activities they want. So it's absolutely the case that cafes differ. Different groups of people like different things. So it's really important to get that feedback. One idea that was interesting was having a who's who of showing baby pictures and people guess which guest it is. So there's a cafe that does that, and they feature a different guest every time. So I thought that was a fun idea, and I'm sure there are variations on that theme that people could come up with, but it might be a nice way to help people bond and get to know each other a little bit better. And then beyond the cafe, so actually today we heard Lunenburg and Burlington both have a lending library now going on at their memory cafe. A lot of cafes are places where guests can be connected with additional community programs. People learn about museum tours and they might decide to go together. A talking book program was mentioned, a choral group. So there's a cafe where there's also a choral group for people with dementia run in the community, and there's now a lot of overlap in who participates. A lot of guests will go out to lunch together. And then a lot of guests will go to multiple cafes. And so it was wonderful to hear Brenda and Andrea talking about how they now have a calendar with a few of the more co-located memory cafes. And there are several communities that are now doing that, creating local calendars, because it's really a way for people to fill their month with meaningful activities and to see each other often enough that they're really forming friendships. I'm just going to pause here and see if there are any comments or questions before I go on. So number 4 was marketing and communications. So there's a lot of collaboration going, which is great. And I love what Brenda said about who to invite to your kickoff, really anybody that you can think of. It's not only good for your cafe, but it's helping your community to become more dementia friendly. I think in a lot of communities, a memory cafe is something really new and different because it's a positive, joyful, strength-based activity. And a lot of times, if you're approaching local business people, for example, and letting them know about your cafe and asking them to spread the word and maybe to donate food or sponsorship, they may be really surprised to hear that there's a fun program for people living with dementia. That may be a first. So I think that that's just another reason why that collaboration is really helpful. A flyer should represent people who, so the quote was, who look like our community members. And in the case of this respondent, that meant people of color. So you want to think about who are in the photos on your flyer if you have photos, and make sure you're really representing the diversity of your community so that people will look at it and say, oh yeah, that's a program for me and for my family. The flyers have, using local images, have the benefit of not looking generic. I do see some stock images that I see on many, many different programs, and I totally get it, And when you're first starting out too, you might have no choice. But if you feel comfortable asking your guests if it's okay to share their photo, you might be able to get some nice local photos. And it could even be, photos from your community, just of, from your town website as well, just to personalize it a little bit. Another comment was that it's nice for your marketing to show a kind of a bistro or coffee house atmosphere. Again, the main point being it shouldn't look like a clinical program. And then another person suggested the language, all welcome, all abilities free of charge, to really emphasize inclusion. A lot of people have talked about personal invitations to the cafe, that's very valuable. Sometimes it really takes a personal invitation for a person to get over whatever concerns they might have, or just to learn enough about what a cafe is that they would come. One thing that I have found is very important is to let them know that when they come to the cafe, no one is going to ask them if they have a diagnosis or what that diagnosis is. Because a lot of times that's a big barrier to people who might be able to really benefit, is that they say, if it's a family member, they might say, if anybody tells my mom she has dementia, she's not setting foot in that room. Or, I don't want to go to a program that's labeled with my disease. So that's one thing you can communicate in a personal invitation that can be really helpful. A lot of people are using social media. How many people here use Facebook, LinkedIn, or, yeah, so about half the room. So that seems to be a bigger and bigger way to keep in touch with people. So staying in touch between cafe meetings. A lot of cafes are doing reminder phone calls, and that can also be a time to ask for feedback about the cafe. Reminder emails, robocalls, some cafes are doing, postcards, newsletter with upcoming cafe activities. Some maintain an active Facebook site where they can share photos. So there are a lot of ways that cafes do it, but it's certainly important to stay in touch in some way between sessions. And then some cafes are doing periodic group activities where they bring several cafes together, like a holiday party or some other kind of activity. So Jamie, for example, in Brookline, Was this your third summer now doing the Camp Memory Connections? If you want to say something about that, I could bring the microphone over, or yeah, if you wouldn't mind coming up here. It sounds like this microphone is the better one.
So in collaboration with the Goddard House Assisted Living, the town of Brookline Senior Center has hosted at Lars Anderson Park for 3 summers now, Camp Memory Connections. So it's an outdoor memory cafe. So it's longer than our usual cafe. We have lunch and a variety of outdoor activities at the park. It's been great for, so 2 out of the 3 summers we were able to host it there. One of the summer we got rained out and had to host it at the Senior Center. But it's been a great event, and it's based off of what's called Camp Dementia out in Seattle. So for those of you who want just a little more information, I would go to the Camp Dementia website. But we've done it very successfully, and we'll continue to do it, hopefully for many more years. So I certainly would suggest it to other communities as well, who have the resources and the ability to do it.
Thank you, Jamie. And so that's a kind of event that can bring people who normally attend other cafes, together, which is just nice to mix it up a little bit. And then finally, rituals. So some cafes have very set, repeated routines that they find helpful in creating that sense of belonging and community. A lot of cafes have a greeter at the door, somebody to be that first smile and just welcome people in and help orient them. One person wrote in that they have a theme song playing as guests arrive, which is the Don't Worry, Be Happy song. A lot of cafes have some kind of welcome activity. So some have a hello song. And actually, you might not be able to see in the picture, it's kind of small. That's here. But we had special guests, John McFadden from Wisconsin and Gary Glazner from New York. Gary runs the Memory Arts Cafe in New York City, and he's also the founder of the Alzheimer's Poetry Project. And John, along with his wife Susan in Wisconsin, are really major national leaders in the Memory Cafe movement, and they were here several years ago for a symposium, and John did his welcome song that he does at his cafe. So he plays the ukulele, and he has a wonderful song that recognizes each person by name. And he made the comment after that this may be the only time in the month that people hear their name, that someone speaks to them by name. That really touched me. I wish I could do that. I don't have the musical ability that he does, but luckily a lot of you out there do some kind of welcome song or an icebreaker, which is an option for those of us who can't hit a particular note. One person wrote in that they do an opening prayer, which is lovely, and individual introductions. So there are lots of ways to do that, and not every cafe does, but it's one option to do some kind of welcome activity. A lot of cafes have a kind of an order of things that is the same every time, and that helps people just feel oriented to the routine and feel a sense of normalcy when they're there. So I actually have a motto for my cafe, which I learned in Guatemala many years ago, Es tu casa, which means this is your home in Spanish. So I say that and explain that every month at our cafe, and I notice people nodding and saying it along with me. So clearly it has become part of our cafe. And I know other cafes have sort of a motto or a theme as well. And a lot of them will do a closing activity as well. So these rituals can also create that sense of belonging. So the proof is in the pudding. So here we're going to try a little bit to get at the question that Andrea and Brenda were asking. What is the impact our cafes are having? So the question on the survey was, based on your observation or formal/informal feedback you've received, have any of your cafe guests formed or strengthened relationships at your cafe? So this is just based on observation, but the results were really interesting. I'm going to move this so you can see better. So 83% of the respondents said that their cafe guests have met new people whom they seem to look forward to seeing at the cafe. And 72% said that guests attend the cafe with friends or family members, and it appears that attending has strengthened their relationship. So that's just observation, but I think it's significant that the great majority of respondents do see those things happening. Now, a smaller number of respondents, 28%, so just under a third, report that their cafe guests have met new people with whom they get together outside the cafe. That's pretty similar to my annual cafe evaluation because I asked that question. And my hunch is that it's just so hard to get together with people. It's so hard to make arrangements that that number is perhaps smaller than it would be otherwise, because these are people who have cognitive and often physical disabilities as well. So it does seem to be more the case that people are meeting up at the cafe and having these connecting experiences here, and a smaller subset are getting together outside the cafe. I'm just wondering if that's the sense that people in the room have about their cafe guests. If anybody has comments. Would you mind coming up? Thank you, that would be great. So Suzanne is gonna come up and make a comment about that.
I just wanted to make a comment. I thought it was interesting. We have both Memory Cafe and a caregiver support group, and having ran these two for several months, I noticed that not only people made new connections, but they are using these connections in other areas. So, for example, as the dementia progressing, they're learning about adult day health programs, and they would try one, and they say, well, it doesn't really seem like the right fit. But having another individual from the group go to the adult day health and having a familiar face there they met within the Memory Cafe is sort of, they have a familiar face there, so they're continuing and they're more apt to continue along with that other program. So it's interesting, we did have that happen at least once or twice, and the caregivers will say, well, can you go for a cup of coffee afterward? Or so yeah, definitely directly have observed that. It's kind of neat to see as a byproduct. So yeah. So with that comment.
Thank you, Suzanne. That's great. So that's another thing that we could be looking for, is whether people are connecting at other programs. And I think that's a great observation, and it goes to the kind of synergies that you see as your municipality kind of works toward becoming more dementia friendly. There's a lot of really subtle things that can happen. There are a lot of moments where people may see a familiar face, or they may encounter someone who now has some knowledge and understanding and is able to sort of open that door to more participation that would have been closed before. So that's really, really good to know. And I think many of you run multiple programs in addition to your Memory Cafe, and I would imagine that you see that kind of cross-fertilization. So that's good. So a few respondents really weren't sure what is happening for their cafe guests based on their observation, and then 4%, so that was just a couple of people, don't see these kinds of new relationships or strengthened relationships. So this is definitely an area for us to keep looking and learning. So everything we've talked about so far, I see smiles around the room now that Mr. Rogers is up on the screen. So everything that we've, oh, actually, I'm sorry, I want to check the chat box. Whoops. Okay, let's see, lost sound. Okay now, okay, good, I'm glad it's okay now. Whew. And I accidentally jumped ahead. So everything we've talked about so far is about the kind of atmosphere that we create once people get to the cafe. And in addition to working hard at this, we always want to ask, are we making it easy for everyone to find us and to make that first step to come in? So I love the Mr. Rogers question of who are the people in your neighborhood? And I really appreciated how Andrea and Brenda are asking that question. At the beginning of their presentation, they started with data from the Massachusetts Health, I'm blanking on the name, but the Healthy Aging Collaborative, thank you, which has these wonderful community-based data reports. And we're very lucky to have that. So it can be harder to find those demographics for some, but a lot of towns have some information, and it's really worth looking and try to see, you know, what are the languages spoken in your community, where are people coming from, and then if you don't see people from all those various communities represented at your cafe, to think about, are there barriers that might be there that we could try to chip away at. So this next section, I'm going to talk about that a little bit. And just a couple of notes. So there are lots of ways that we're diverse: culture, gender, gender expression, language, race or ethnicity, income, education, disability, intellectual or physical, age, sexual orientation, et cetera, et cetera. So this is a huge topic that I can't possibly do justice to in this little amount of time, but just to acknowledge that there are lots of ways that people differ and that there may be barriers that we want to be mindful of. Just to say, we live in a country with a long history of treating some groups of people much worse than others. So there's a lot that has gone before that Memory Cafe opens its doors that affect who's going to feel comfortable coming, that, you know, is well beyond what any one person did or controlled, but it's a reality. And I think if we're mindful of it, it helps us be aware of where some of the barriers may be, and it helps us be able to chip away at them. We know that dementia affects people of all backgrounds. So the goal is really to acknowledge the barriers that may be there and to do our best to work through them. So just to say a little bit more about that, this is a map of Greater Boston from Northeastern University. We live in highly segregated communities, and mostly people are attending cafes who live in the local area. So I say this just because this is a fact. You know, a lot of times I hear from cafe coordinators that their town is pretty homogenous, and there are reasons for that. It's because there's been hundreds of years of federal, state, and local laws promoting, in some cases, enforcing segregation. So I just want to acknowledge that. If anybody's interested in knowing more, some of you might know the book, The Color of Law, by Richard Rothstein, who is a really renowned economic researcher, and he has a 17-minute video now, which is like a tour through how did we get to this point in the United States. So I put the link up there just in case you're interested. But I just think it's worth acknowledging our communities look this way for a reason, and it's not a reason that anybody in this room or on the phone caused, but yet we find ourselves here, so we have to be aware and see what we can do to counter these tendencies. So the other piece is that professional care providers, nurses, aides, companions often come from underserved communities. So I know here for my Memory Cafe, the great majority of my guests are white and English speaking, and the great majority of the paid aides who come with them are people of color. And so that's one way that there is cultural, ethnic, racial diversity at my cafe, and I try to work very hard to be mindful of the different languages and the different backgrounds of the care providers, and to really try to make sure that they feel welcome. And when we're doing an activity that has to do with heritage, to give them a chance to share about their background if they want to. So this is just a page, a slide from a webinar that was done in, actually it was last January by the Mass Home Care Council and UMass Boston about who is our population of home care providers in the state of Massachusetts. And of course, this isn't going to be the same everywhere in the country, but I'm guessing there are some threads that carry through. So almost half are immigrants. Almost half are getting public benefits because they just don't make enough doing their vital work as home care providers. So I just put that out there because oftentimes this is what cafes, at least in Massachusetts, these are the demographic issues that we see. So the goal is really reach everyone who needs us, serve everyone who needs us, support all care partners, professional and informal, and to do our best, given that there are a lot of structural barriers in place that are pretty hard to work against because there's a lot of trust issues there for good reason. So, but you see the soccer balls going in the net, so we should feel encouraged that we're going to keep chipping away at this. So the survey asked, what about language, culture, and other differences? Because we know when we talk about a sense of community and belonging, that's going to be different for different people. Very often that has to do with familiarity. You know, if we go someplace and there's music or food that's familiar, it gives us that sense that we belong here. This is like home. So that's not necessarily going to be the case for people of different backgrounds. So the question was, are there steps you've taken to create that sense of community and belonging for attendees of various backgrounds? And 43% said that they are working through their decorations, their music, and their food to create an inclusive atmosphere. So that seems like the most common way to try to get at this issue a little bit. And the same percentage said that their cafe attendants all come from a similar background. So again, that's the case for a lot of cafes. About a third are working hard through their marketing to outreach to varied communities. So being really thoughtful about the Mr. Rogers question, who are the people in our neighborhood, and try to get the word out to them. 25%, it was sort of this other category, but it was mostly responses about really working to include the aides who come from various backgrounds and make sure they feel really welcome, and also guests who are in residential settings. And one person commented that, you know, if my mother were at an assisted living residence, I would want her to be able to get out in the community and do other things as well. So this person felt strongly about making sure that people from residences were able to know about the cafe and come to the cafe. And I'm just going to put in a side note there, which is that if you do welcome groups to your cafe, I encourage you to require that the staff person contact you in advance, just so you have an idea of how many people are showing up, and that they need to bring, you know, enough staffing with them so that you don't get stuck with something you're not prepared for. About 8% said, you know, yeah, this issue's on our radar screen, but we haven't worked on it yet. And then 2%, this is their stock in trade. They have very diverse populations attending. They have multiple languages going, translated flyers, multilingual staff, and volunteers. So that is just pretty rare. There's only a couple cafes in our who responded who are really working on this as a core part of their cafe. So I'm going to just go over a few specific steps that respondents mentioned, because I think these are really interesting and helpful. So one was doing outreach to all communities within the area, including faith communities, group homes for people with intellectual/developmental disabilities, and residences for older adults. Another step is to represent many communities on the flyer through images and language, to have a range of music and food. One person commented, we have multiple participants who are originally from other countries, and we use storytelling to create shared experiences, activities which would expose us to other cultures. So that person's really seeing that as a source of richness and a source of connection. I think sometimes there is a kind of tipping point where we go from feeling like it's hard to build cohesion when people come from so many different places to actually finding that it's a wonderful new source of cohesion, because everybody shares certain common experiences as human beings. The importance of family, there's a lot of values that are really common across religion and country and background. And it can be very exciting and encouraging when people are able to sort of communicate enough from the heart that they make those connections with people who might not have the same first language or look the same. And I think cafes are a place where those kind of really deep connections happen all the time. So I think there's a lot of potential there. I know we have a couple of years running, we've had a guest artist who's a Shawnee, and I wonder if he's the one who came to your cafe. So he's a traditional Irish storyteller, and we've had him come in November, and we use that as a time to talk about heritage and gratitude. Those are always our two big themes. And he is able to elicit stories from people in the room about countries of origin and a lot of differences in their background. And there's this wonderful feeling that grows in the room because we're all human beings together. And it's always really magical when some of the aides feel comfortable sharing, because we often will have aides here from many different countries. And I think it's that sense of connection that is really what cafes are all about. And in fact, there are not very many places I know in my month that I go where that kind of happens. I feel like memory cafes are really one of these very special and profound places where people really connect at that heart-to-heart level. So it can really be beautiful to have people of different backgrounds and connect that way. So the last person here mentioned we have multilingual staff. Staff are able to translate. So when they had a guest speaker who spoke in English, they translated to Spanish, which is their predominant language. You know, I know that this is challenging because having interpreters, it's not always possible. A lot of cafes don't have multiple staff people, but I see it as sort of something to be aware of, something to think about and to work towards. Here in Waltham, we have a large and growing Guatemalan population. We have a large and growing Ghanaian population. And I have been trying to reach out without any success, I'll say so far. I've totally struck out, but I've been making connections and just trying to let people know about the cafe, and I'm gonna just keep trying. And at some point, I may change the food that we have. You know, I'll do whatever I can to try to have our cafe look more like the population of Waltham. So I'm just sharing that in that it's not easy and it's a journey. That's why the photo, it's not a one-time thing. Any comments about the question of serving people from various backgrounds? Anybody in the room or on the phone? Let's see. Anybody on the line want to share a thought about that?
Connecticut?
Go right ahead.
One possibility might be a branch library in that specific neighborhood.
Mm-hmm. Yeah, it's really good to think about location. And if your program is located in a neighborhood, it's just going to be much more accessible to people who live there. So thank you for that point. Would you mind coming up, Cece? Thanks.
I'm Cece King. I'm a facilitator. And just listening to this whole last episode about culture, what I do is a combination of movement and breath and poetry and stories. And I was thinking it would be nice if before going to a site, we communicated and said, so what are some of the cultures represented? And it is often the aids. So that, for example, if I know that there's somebody from Ghana who is an aide, I could bring some poetry from Ghana and we could incorporate that into whatever the activity was. So this idea of being proactive and thinking ahead of time and collaborating is really appealing.
I love that idea. Thank you, Cece. And, you know, just another comment about the professional caregivers. You know, it's from the very start, the idea of memory cafes is that they serve the person living with dementia and they serve the care partners. And the care partners include family members and friends and also professional caregivers. I've noticed something I've been running my cafe since 2014, and I've noticed, and I've had many conversations with some of the professionals who come about the level of stress that they're under. And, you know, that this is not a very welcoming time for people who are immigrants. And they have really hard jobs, and a lot of them have left their own children, their own aging parents in their home country because They're just trying to make money to send back so that their kids can eat. So I think that, you know, that's a beautiful idea, Cece, about incorporating some content from cultures that might be represented, whether it be people living with dementia or professionals or family members at the cafe. And I think those could be really magical moments for those folks and really give them a lift. We know the professional caregivers are doing such vital work. We really count on them to take care of the people who are the most vulnerable. And so when we at our memory cafes can do a little bit to help and care for them, it's well worth it. So I am gonna check the chat box here. So Mary is commenting, this winter season, so over 5 months, we moved our indoor location from a Christian church to the public town library. We attracted 2 walk-ins to our first November cafe because they were visiting the library. At the church, we never had walk-ins. I love this new visibility. Thank you, Mary, for sharing that. And I think, you know, it's interesting because I just was in touch with somebody today who's thinking about starting a cafe in a house of worship and having it be specifically a worship-based cafe. And I think that's great too. So I think we need all of it. You know, we need cafes that are primarily focused on just being in open and accessible places like a town library. And it's also wonderful to have really specialized cafes. So if there's a congregation that wants to have it be for their congregation or people of their denomination and include religious content, that's great too. I think, you know, it's not one or the other, it's really both and. But that's just me. Anybody else want to make a comment? Okay, so we're getting close to the end here, folks. So summing up the results of this survey, in general, what really struck me is that memory cafes are doing an amazing job creating a sense of community in many, many creative ways, despite the challenges of dementia, which include ongoing disease progression. So that's a really tough thing to work with. And memory cafes are doing an amazing job. And I'm sure you all have innumerable stories, and I hear them all the time, of just these ways that the cafe matters so much in people's lives. The most important ingredients are warmth, personal touch, and hospitality. And, you know, I do find sometimes when people are thinking about starting a cafe, they assume that it's more going to be about clinical expertise. It's more going to be about, you know, planning a really tight schedule of activities and kind of having it just so. And what keeps coming up is that it's really more about creating a living room that people can come to and feel what they don't get to feel very many places in their lives, which is at home. So it's helpful to see that that's what respondents to the survey are saying. Let's all just keep doing our best to ask the Mr. Rogers question, who are the people in our neighborhood, and just, you know, keep working to become more accessible. It's a journey. And then I wanted to share this comment from one of the survey respondents, or 2 actually. All who enter our cafe are met by staff who are warm and caring. The message participants receive is that all are welcome, and each person is made to feel they matter. So that is just great. I think that's what it's all about. So, any other thoughts or comments? Anybody in the room or anybody connecting with us from afar? Let's see. So, here are a couple of comments. So, Sandy from Flagstaff, Arizona, where there's no snow, I bet. Sandy says, I've heard of a model where care partners and people with dementia go into different rooms at cafes. Let's see, go into different rooms. At a cafe, they're in the same room. Comments? Anybody have comments on the idea of separating the 2 groups? Can you come up? All right, Tracy's going to come up and make a comment about that. Thank you. Talk right into here.
I 4 times a season, I have a memory cafe with a caregiver support group and a lunch and an art program. 6 other times, I just have the memory cafe. So I have 10 memory cafes during the year. So when we have, actually tomorrow we're having this, when we have the caregiver support and the memory cafe and the lunch. So for the caregiver, it's mainly spouses, I actually have them go into another room to give them privacy. And I do not sit in with them. I'm there, but I do not sit in with them. They meet with a social worker, actually from here, Joanne Pesquith. And while they are in another room, we have the seniors who have memory loss or dementia. They are doing an art therapy project in our main room. And then everyone, after both programs are over, everyone comes together in that main room and we have lunch together. So we give them, so we do separate for that.
Thanks. Thanks, Tracy. And I know here in our local community, the Alzheimer's Association has had programs for people with earlier stage dementia in couples where they're separated into care partner group and people with dementia group. I think they all these types of programs serve their purpose. Sometimes it's really important for care partners to be able to talk on their own. Sometimes it's really important for people living with dementia to be able to talk on their own. The traditional memory cafe model is that they're together. And one thing I heard a lot from our guests is that they didn't find many places that they could do things together. So again, I think they serve different purposes. There's a comment here from Lori. That's the difference between support groups and cafes. So typically cafes are a mixed group of care partners and people living with dementia, and support groups tend to be more focused on a specific group. I think that another thing about having people together is that it's easier to run, because you know that if there's somebody whose dementia is advanced enough that they had to come with somebody, that somebody is there with them, that somebody knows them well. And so you just have more hands on deck. Come on up, Suzanne.
So I'm Suzanne from the Winchester Council on Aging. So we've been doing our cafe for, it's going to be almost a little over 2 years now. And the first year we were running it, we did give people the option to, if they wanted to stay with their loved one and participate in activity with them together, they could do that. Or they could go into the room next door and have the opportunity to have a little bit of caregiver support. And myself and the co-facilitator would kind of break off, and one person would do an activity with the group and the other would facilitate the support group. And we did find that a lot of people wanted that caregiver support and took advantage of that. And then those who weren't comfortable leaving their person or just wanted to stay with them for whatever reason were able to do that as well. So totally optional. We did have a good turnout for the caregiver piece. And I think they felt good because they knew that their loved one had respite available. So, you know, it can go either way. And again, doesn't have to be one or the other. Now we find ourselves sort of leaning more towards the group activity. We find, you know, it's nice to have people come together. And so that's just what we did for ours.
Thanks for sharing that. So there's many options. No one owns the cafe model, so people can do what they feel fits for them and what they are interested in trying, and also what needs they're hearing. You know, if you're in a community where there is no caregiver support group and you're trying to kind of cover that base as well, you might experiment with something like what Suzanne or Tracy are describing. So another question, have others provided respite volunteers? How to recruit and train these folks? Not quite sure. I'm not quite sure, Mary, that I understand your question. Are you able to talk to us? I think the lines are unmuted. Maybe you don't have, you're not able to talk to us. Do I hear Mary? hear somebody. Does anybody have a response to that? Respite volunteers? So I'm assuming you mean to provide an additional service, but I might be wrong. So maybe you can follow up with me after the meeting, Mary, and just let me know a little bit more specifically the type of thing that you're interested, or you could send that to the Percolator Google group and get responses that way. Yeah, I'm sorry, I'm just not totally clear on the type of situation that you're talking about. So any other comments, questions? Anybody want to share a story about community and belonging at their cafe? Okay, so I think then we're going to wrap up. So our next meeting will be in March. I will be in touch with all of you about the date. And again, if somebody has a cafe that they would like to present, please let me know. I want to thank Brenda and Andrea again very much, and all of you for being here and being with us on the line. Those who are here in Waltham, there's plenty of snacks in the back, and feel free to hang out and network and talk. I am going to go ahead and end the Zoom meeting and conference call, and we'll hope to be back together in 3 months. Have a happy and safe winter, everybody. Thanks.
Controls.